Welcome to all. Myself Sajithjra, lecturer of Emmanuel Arasar College of Pharmacy. In this session, we discuss about antiviral agents. First of all, antiviral agents are chemical substance used for the treatment and prevention of viral infections. These drugs act by inhibiting viral replication inside the host cells. Unlike bacteria, viruses cannot reproduce independently because they require host cellular machinery for the replication. Therefore, development of antiviral drug is difficult because the drug must selectively inhibit the virus without damaging the host cell. Most antiviral drugs are inhibit replication rather than kill virus completely, depend on host immunity for final elimination of infections. These antiviral drugs are effective when given early in the infections. Importance of antiviral therapy. This therapy reduces severity and duration of infections, prevents complications, and decreases mortality. And it improves the quality of life in chronic viral infections like HIV and hepatitis. Then, characteristics of antiviral agents. First one, restricted spectrum. Most antiviral drugs act only against specific viruses. Dependence on host immunity. Complete eradication of virus depends on immune response. Intracellular action. Viruses multiply inside host cells, therefore, drugs must penetrate cells. Activation of requirement. Many antiviral drugs are prodrugs and it requires activation by viral or host enzymes. Resistant development. Mutation in viral enzyme may lead to drug resistance. And finally, toxicity. Because virus use host machinery, selective toxicity is difficult. Most inhibit replication. Cure depends on host immune system to eradicate. If patients are immunocompromised may have recurrence. Many needed to activated by viral and cellular enzyme before exerting antiviral effect. Activity of enzyme and concentration of substrates will influence the efficacy. Then antiviral replication cycle. Viral replication cycle, it has many steps. First step is attachment of host cells. Second one, penetration into the host cell. Third one, uncoating of viral nucleic acid. Fourth one, replication of viral genome. And next one is synthesis of virus proteins and assembly of viral particle. And finally, it releases the mature viruses. The antiviral drugs act by interfering with one or more stages of this cycle. Then, classification of antiviral drugs. These antiviral drugs are classified into various classifications such as nucleoside and nucleotide analogues and non-nucleoside reverse transcriptase inhibitors, protease inhibitors, DNA polymerase inhibitors, uncoating inhibitors, and finally immunomodulators. Example of nucleoside and nucleotide analogues are acyclovir, rifampicin, etc. Example for non-nucleoside reverse transcriptase inhibitors are nevirapine, and then protease inhibitors are ritonavir, indinavir, and DNA polymerase inhibitors are foscarnet. Uncoated inhibitors examples are amantadine, rimantadine, and finally immunomodulators examples are interferons. And then move on to the mechanisms. General mechanism. Nucleoside analog resemble natural nucleosides required for viral DNA or RNA synthesis. Mechanism. Drug enter into the infected cell, then the drug converted into active triphosphate form. This active triphosphate form inhibits the viral polymerase enzyme. It causes premature termination of viral nucleic acid chain, and the effect of this general mechanism was it inhibits the viral DNA synthesis, and it inhibits the reverse transcriptase, and finally the inhibition of RNA polymerase. Then saw the general mechanism of action. First, the general mechanism of action of acyclovir. Acyclovir is a guanine nucleoside analog mainly active against herpes virus. And then the mechanism of action. Step 1, viral thymidine kinase convert acyclovir into acyclovir monophosphate. And next, this step leads to host cellular enzymes convert it into triphosphate form. And the acyclovir triphosphate inhibits the viral DNA polymerase, and it leads to the chain termination during viral DNA synthesis. The importance of this mechanism of action is selective toxicity because viral thymidine kinase activates the drug more effectively than the host enzymes. And then uses of acyclovir. Clinical uses. It active against virus type 1 and type 2, and it active against genital herpes. Adverse effect. The adverse effect of acyclovir is nausea, vomiting, renal toxicity, etc. Resistance. It occurs due to decreased thymidine kinase activity. It altered viral DNA polymerase. And then see about ganciclovir. Ganciclovir. The mechanism of ganciclovir is inhibit viral DNA polymerase causes inhibition of viral DNA synthesis activity. It is effective against lot of viruses such as CMV virus. Uses CMV virus pneumonia and CMV virus colitis are the main uses of these drugs. Adverse effect. Major adverse effect was bone marrow suppression, leukopenia, thrombocytopenia, anemia, etc. CNS effects are headache, confusion, seizures, psychosis, etc. Clinical note. Many patients discontinue this therapy because of severe toxicity. And these are the structure of acyclovir and ganciclovir. And see about other drugs such rifampicin. First of all, rifampicin is a broad-spectrum antiviral drug. Mechanism of action: it inhibits viral RNA polymerase, prevents viral RNA synthesis. Uses: it is used in the respiratory viral infection, influenza A and B, viral hemorrhagic fevers, etc. Administration: it administered in the form of aerosols, oral administration, and intravenous. Adverse effect. Major adverse effect of this drug is hemolytic anemia, bone marrow suppression, fatigue, rashes, etc. Contraindication. Not yet recommended during pregnancy due to teratogenicity. And next we see about iodotoxuridine. First of all, iodotoxuridine mainly used for various bacteria such as herpes bacteria. Uses of this drug is it is active against herpes bacteria and some ocular viral infection. Route of administration: it is administered through topical ophthalmic preparation only. And then trifluridine. trifluridine most effective and less toxic than iodoxyuridine. It is also used for a lot of ocular viral infections, and route of administration is topical ophthalmic preparation only. And then see about phoscornet. Phoscornet is an inorganic pyrophosphate analog. Mechanism of action. It direct inhibition of viral DNA polymerase and reverse transcriptase. Important features. It does not require activation by viral enzymes. Uses and toxicity of phoscornet. The clinical use of phoscarnet is it is used for CMV viral infections, CMV infections in AIDS patients, acyclovir resistant herpes infections, HIV infections. Adverse effect, nephrotoxicity, hypokalemia, seizures, etc. And then see about antiretroviral agents. Antiretroviral agent is used in the management of HIV infections. Objectives suppress the HIV replications, increase CD4 cell count, prevent various infections, and improve survival. Drug classes reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, entry inhibitors. Cellular enzyme phosphorylate to the triphosphate form which inhibit the RT and causes chain termination. The common side effect of this antiretroviral agents are headache, nausea, insomnia, etc. And see about the various antiretrovirus agents such as pseudoviudin. Pseudoviudin is a nucleoside reverse transcriptase inhibitor mechanism. It converts to activate triphosphate form, inhibit reverse transcriptase, cause chain termination. It uses the HIV infection. It is used for various HIV infections, prevention of fetal transmission infections. Adverse effect. Hemolytic effects such as anemia, etc., are caused by this pseudobutin. Other effects such as headache, nausea, insomnia are the common effect. Benefit. It reduces the mortality, delays progression to AIDS, improve quality of life. Other retro Other reverse transcriptase inhibitors, nucleoside analogs. The adverse effect of this nucleoside analogs are pancreatitis, peripheral nephropathy, and peripheral neuropathy. And then mechanism of action of non-nucleoside RT inhibitors are it directly non-compete with inhibition of reverse transcriptase. And then see about protease inhibitors. Protease inhibitors This protease inhibitors blocks the viral protease enzyme required for maturation of HIV particles. Mechanism. It prevents the cleavage of various proteins and produce immature non-infectious virions. Example, ritonavir, indinavir, saculavir, etc. Adverse effect of this protease inhibitors are first, toxicity is metabolic effects such as hyperglycemia, diabetes mellitus, etc. And then gastrointestinal effects such as nausea, vomiting, diarrhea, and abdominal pain. Importance of these protease inhibitors are drug concentration must be maintained continuously for effectiveness. And then see about amantadine and interferons. First, we see about amantadine and rimatidine. First, it is also known as uncoating inhibitors. Mechanism of action of these both drugs are it prevent viral uncoating in influenza A virus. Uses prevention of influenza A, early treatment during in various viral infections. Adverse effects: CNS stimulation, insomnia, nervousness are the common adverse effect of these both drugs. And then we see about the rimantidine, um, less CNS toxicity than amantadine. And then see about interferons. Interferons are naturally occurring proteins with antiviral and immunomodulatory action. So it is known as immunomodulatory inhibitors. Mechanism of action of this interferons are it inhibit viral protein synthesis, enhance immune response, etc. Types of this interferons are interferon alpha, interferon beta, and interferon gamma. Uses and toxicity of interferons. The main clinical uses of these interferons are hepatitis B, hepatitis C, and some cancers and some viral infections. Adverse effects of these interferons are flu-like symptoms, fever, fatigue, bone marrow suppression, and depression. And then see about the advantages of antiviral therapy. Advantages of antiviral therapy are it controls viral replication, reduce complications, improves immunity, decrease transmission, increase survival rate, and useful in chronic infections. Limitations of antiviral therapy. Limitations of antiviral therapy are drug resistance, toxicity, limited viral selectivity, expensive treatment, and it not affect lot of viruses. Recent advances in antiviral therapy. Modern approaches. Combination of antiviral therapy, highly active antiretroviral therapy, monoclonal antibiotics, and gene therapy, RNA interference technology, antiviral vaccines, etc. Conclusion: antiviral agents plays an important role in management of viral diseases. Most drug